I went for my morning routine. After I came back from the bathroom, I felt there is something wrong in my speech, and this side of my face was like this, getting like this. Then I told my wife, this has happened. Do you notice any change? Yes, I can't speak properly also. Fortunately, this hospital is just 3 or 4 or 5 minutes drive from my place. So I was brought here. I was in full senses, but I was feeling some weakness somewhere in my body, especially on my tongue. So when he saw, and he said there is hardly any time left because it has been already late. There are only 20 minutes at my disposal, and I must take all start the treatment. So thank God and thanks to Dr. Mukherjee, he arranged everything, took me the CT scan. And from thereafter, he took me to the ICU. No formalities were completed. He said, no, these are secondary things for me. I know what should I do. Great of him. There are very few doctors who do like that, the way Dr. Banerjee handled me. So they started the treatment in the ICU. They gave me some injections. With that, by evening or by afternoon, I don't really remember, he was very happy with the treatment he did. He said, nothing doing, you are out of it, we have dissolved the clots, rest here. So I was here in ICU for 2-3 days, and the treatment, hospitality, courtesy of the staff is my first experience in life in a hospital. God bless them all. They were very caring, very sympathetic, as if it is the prime duty for them to look after me. I noticed in ICU that almost everyone there was taking full care of me. So by the grace of Almighty, after 3 days, they brought me to the room. I was there, same courtesy, same hospitality I was getting, and I thank my stars and my people who brought me here. And by the grace of Almighty, I always say, I am better, much better, but I have not yet started going to my work, which I will start soon as advised by the doctor. Everything was excellent here, but I sincerely wish, in spite of all this, I do not wish to come here again. This is a very good hospital, courteous, sympathetic. That's all I can say.
The patient, Mr. Vishwanath, was brought to me by his daughter-in-law with the history that he could not speak and he had weakness in the right upper limb. And when I inquired about the onset of these symptoms, I found out that it was 2 hours 15 minutes back. I looked at my watch and I realized that I've just got 45 minutes to do whatever I have to do, because we have this 3 hours time embargo for giving an intravenous RTPA, which is a clot buster and which is the newest treatment for stroke. I looked at my watch, then I did 3 things. I called up my senior resident to get the stroke unit bed ready, called up the critical care person to get ready, and I called up Dr. Devlina to get the CT scan ready. I rushed into the CT scan personally. I saw the CT scan did not show a clot, did not show a bleed. I didn't have time for an MRI. I rushed into the stroke unit, and to my pleasant surprise, I was able to start the thrombolytic therapy within 40 minutes, thereby reducing our door to needle time to 40 minutes, which to my mind was a matter of great satisfaction to me and my team, which consists of Dr. Shamsher Trivedi, Dr. Rajshekhar Reddy and Dr. Amit Ray. And I am ably supported by Dr. Aminder and his team of the critical care, the people, my neurosurgical colleagues, which includes Dr. Jha, Dr. Vipul Gupta, Dr. Valia and Dr. Sandeep Vaishya, and also Dr. Devlina, who immediately gave me the support of doing a CT scan. I think ultimately it is the team effort which goes into making this program for infusing clot busters for stroke a success. I wish more hospitals, more teams take over this mission of treating strokes appropriately, correctly, in the right way, and we have more successful outcomes as we had in this index case. Thank you very much.